Good day, everyone. It is with great pleasure that I acknowledge this momentous day, May 12, 2022, International Nurses Day, and celebrate the people who the Director General of the World Health Organization, Dr. Tedros, dubbed the backbone of our healthcare system, our nurses. A sincere thank you for your diligence and faithful service to society. I fall in love every day with the healthcare system, and I also fall in love every day with each and every one of you who man this system. This year's International Nurses Day theme, as announced by the International Council for Nurses, is Nurses, a Voice to Lead. Invest in nursing and respect rights to secure global health. It focuses on the need to protect, support, and invest in the nursing profession to strengthen health systems around the world. Nursing is and will continue to be a profession with high standards and a strong sense of public service. A nurse functions as a technical expert, an educator, a counselor, a resource for a patient and their family. They are the most important link between a medical doctor and the patient. A doctor makes the diagnosis and prescribes the medication, but the responsibility for the day-to-day care rarely rests with the nurse. The former president of the International Council for Nurses, Ms. Annette Kennedy, said that this global COVID-19 pandemic has shown the world the important role that nurses play in keeping people healthy across the lifespan. And true to these words, our nurses in Trinidad and Tobago rose to the challenge and excelled. We can never thank our nurses enough for their unselfish sacrifice that they made for so many who fell ill and needed their care. The COVID-19 pandemic has highlighted even more the vulnerabilities associated with underinvestment in healthcare systems. Therefore, the Ministry of Health continues to prioritize the development of its most prized resource, our team. The WHO's Global Strategic Directions for Nursing and Midwifery 2021-2025 and the State of World's Nursing Report 2020 have contributed to the ministry's plans for the nursing fraternity. These plans include the completion of the rationalization of nursing and midwifery education, with related recommendations and commencement of the policy dialogue in collaboration with PAHO, WHO, and the University of the West Indies, focusing firstly on primary healthcare staffing and services. Examples of just some of the investments the ministry has made in nursing include: 1. The training of over 100 district health visitors in 2020 to 2022. I remember fondly the event we had at the Hilton. 2. Training of almost 200 nurses in management of critically ill and ICU patients, with a focus on managing patients with COVID-19. And third, the standardized neonatal intensive care nursing course. We continue to pledge to invest in our nurses. Nurses have a major impact on the standard of care experienced by the patient and, by extension, the surrounding communities that we serve. They have a unique opportunity to influence positive change in the way members of the public perceive the hospitals, health centers, and clinics. While a nurse's voice is usually associated with compassion and care, it is really a powerful instrument that can influence decision makers, policy makers, government officials, healthcare professionals, and the general public, and also people in general at every level of society, to ask them to stop, listen, and take note, and subsequently lead them to take action. We at the Ministry of Health value our nurses and the contributions that these phenomenal professions and professionals have made to the overall delivery of quality care throughout our healthcare sector. To each and every nurse, I say again, thank you for working with us to achieve the standard of care that we have set for healthcare in our nation. We would be lost without your focus and direction, your gentle authority, and of course, your constant determination and compassion. To all nurses, I say, happy International Nurses Day. Thank you.